Hello, everyone. My name is Kalia Lemon, and I have chosen to do my presentation on the racial healthcare disparities and inequities faced by low income and minority populations. I chose this topic because it's something that I have personally experienced myself as a minority and using state insurance, better known as Medicaid. Uh, I've had my experiences. And so I've also worked with this population during my internship, and I've had to advocate and support my clients through the downs of this particular system. So um, this is near and dear to me. So I hope you all learn something new, maybe feel vindicated or validated or even heard, because maybe it's something you've experienced before. Um, and just, yeah, simply enjoy my presentation. So thank you. All right, so a simple definition of racial health care disparities. It simply refers to unequal access to health care and the quality of healthcare services that are experienced by different racial and ethnic groups. These disparities frequently stem from systemic inequities. We have a long legacy of historical discrimination here in the United States, stemming back from forever, the beginning of time, and to today, sadly, 2025, where it's still being experienced. So, a lot of these factors, as listed, include income, education, and housing. Still current issue. These are all policies that we can do presentations on every day, but focusing on racial healthcare disparities, I will explore different policies, interventions that we could use today that are current for our clients, and also provide some recommendations for addressing these inequities so that we can have a change here and that the uh, discrimination and unequal treatment in the United States can no longer exist. So, um, that is definitely the goal. I also want to discuss different strategies that we as social workers could use to, foster progress in this area. Research shows minimal change in the overall uninsured rates between 2022 and 2023. The data consistently shows that people of color, which includes everyone, Black, Hispanic, um, Indian, Alaskan, like, we're all disproportionately uninsured or even underinsured compared to our white counterparts, uh, facing a lot of disparities in that area. Um, African Americans, male and female, also have a higher rate of chronic conditions. We face in our families, we have a lot of hypertension or high blood pressure and diabetes, which makes the mortality rate higher in Black and Hispanic adults versus white adults. And Black women, we face much higher rates of maternal mortality, which is just death, simply dying because we're giving birth. And our infants, they also face a higher death rate compared to other groups. African American women are 3 times more likely to die from a pregnancy related cause than a white woman. And this again is due to implicit biases, simply not having proper access to care, and the chronic health conditions that are not monitored, which I mentioned a little bit earlier, which is hypertension and diabetes. One policy that directly impacts racial healthcare disparities in the United States today is the Affordable Care Act, or ACA, which was established in 2010. So I particularly like ACA because they aim to, as listed, reduce healthcare inequities by expanding access to insurance coverage. They want to improve the quality of care that minorities are receiving, and also address social determinants of health. So this includes many provisions that are consistent with the AMA, or the American Medical Association, and it holds the potential for a better healthcare system. Uh, so all but 10 states have adopted the Affordable Care Act's expansion to cover adults on Medicaid with an income up to 138% of the federal poverty line. So this helps tremendously to reduce the rate of the uninsured population of ages up under 65 years old. So this means the federal poverty level for a single family is up to like $30,000, a family of four up to 60,000, and a family of six upwards to $100,000. So this policy, it aims to definitely ensure all families, uh, helping those who are in poverty, helping those who may not be in exactly the poverty level, but not able to fully fund a family of six on an income. So this policy really helps to reduce that. While the number of people who fall into this coverage gap has declined, those 10 states that have not implemented this policy, it's about 1.4 million people who are still uninsured due to this coverage gap. During the pandemic, the coverage expansion that was put in place by ACA, it helped to serve as a safety net for the marginalized community populations. So this was a gain in Medicaid and marketplace coverage because it contributed to substantial declines in the uninsured rates. Another policy provision that ACA has contributed to is simply implementing the policy that prohibits discrimination. Uh, it's sad that this has to be said today, and it's 2025, but yes, they have implemented that policy, and it's based on discrimination of race, ethnicity, or any pre existing conditions. So this ensures that all individuals, including minority populations, that they will not be denied coverage or charged higher premiums. It's based off of these factors alone. The Affordable Care Act has also established a national strategy to prioritize the improvement of healthcare quality. So, them, them prioritizing this, it develops quality measures. So healthcare providers, they have to report all of their quality measures or simply face financial penalties. Another policy that a provision that they have created in their policy is that they collect state excuse me, they require the states to collect race, ethnicity, and language data to enhance their understandings of the different cultures, different populations, and it will, in turn reduce the healthcare disparities. So, with that, they know that understanding these factors of race and ethnicity, it can influence the risk of certain diseases. So healthcare providers can tailor care um, their work to meet the unique needs of each individual. Has the ACA achieved its goal? Well, their goal is to make affordable health insurance available to more people and expand the Medicaid program to cover all adults with income below the level the federal poverty line. So to date, not all have expanded their Medicare programs. But research shows that ACA significantly increased insurance coverage among racial and ethnic minorities. So, for example, uninsured rate for Black Americans dropped by 40%, and the gap in uninsured rate between Black and whites also narrowed. So, people living in Medicaid expansion states, they've benefited the most in terms of coverage. They have uninsured rates are lower in these expansion states versus the non-expansion states, and the black-white coverage gap in those states dropped from 8.4% to 3.7%. So that's a win. The ACA, the unintended consequence is that they inadvertently encourage hospital mergers. So the hospitals have formed larger healthcare systems, which reduce competition. So this leads to higher healthcare costs and it limits the choice for us as patients. Um, yes, they've expanded their coverage, but many individuals face higher deductibles and out of pocket expenses, which overly impacts low income and minority populations at a higher rate. Just a fact. Um, Also, because there's limited providers, minority populations are not easily able to get to these healthcare providers, just because of other systemic uh, discriminations, such as transportation and housing. So, ACA is definitely, had the right idea, but it can have a little bit of tweaking going on. Um, some of these unduly disparities between Black and Hispanic communities results in a lack of access to affordable healthcare coverage. The insurance accessibility has improved, but still the quality of care and healthcare outcomes continue to persist. Back to my opening statement of Black Americans still facing higher rates of maternal mortality and chronic illnesses compared to our white counterparts. So, what can we do? As social workers, we play a vital role in advocating racial healthcare reform, and we face major challenges in these efforts. One challenge is navigating systemic barriers such as inadequate funding for programs designed to support underserved populations. We, as social workers, we contend with implicit biases as well in the healthcare system, and that can also impede in our advocacy for equitable care. So, as healthcare social workers, we should advocate for organizational practices and policies that promote and support cultural diversity among the staff and throughout the healthcare organization. I believe hiring and retention policies would ensure diverse client groups are represented among the personnel and institution wide education and training programs to develop specialized expertise such as bilingual and bicultural skills among the staff. There's literally no endpoint in the achievement of cultural competence. That's actually one of the reasons why I got into social work, because it's continual growth, continual learning, because every day is new. So, the continuation of development and maintaining cultural competence is a process of learning and self reflection. So, developing this and promoting this will allow individuals and institutional levels and all the societal levels um, to continue to be informed. Also, we should get involved with community health programs that focus on prevention and culturally competent care. These programs, we could educate the community to learn the benefits of having medical insurance. We could invest in implicit bias training. Um, That'll help with with all patients, lessening derogatory language, and just making it a more pleasant and safer experience for all individuals. Um, I believe that advocating for more policies that address racial health disparities will be essential in reducing the gap, as well as working closely with social workers to implement community-based solutions. This would involve social workers providing accessible resources and educational tools to empower minority populations. So, in closing, racial healthcare disparities have been a determinant in our society and remain a challenge today. The Affordable Care Act aims to create progress through coordinated and sustained efforts. So, we as social workers, with our distinctive skills and commitment to social justice, it's pivotal for us to support this effort. By advocating for ourselves and our communities, we must start by addressing systemic barriers, foster collaboration with communities and stakeholders, and encourage for more equitable policy. It is foreseeable to create a healthcare system that serves everyone fairly. Ultimately, eliminating racial healthcare disparities is not just a moral imperative, it's essential to achieving a healthier, more just society. Let's continue to a future where everyone, regardless of their race, ethnicity, or class, has access to care that they deserve. Thank you.